Hi everyone, I'm Leslyn Keith. I'm a certified lymphedema therapist, and I've been treating lymphedema and other lymphatic disorders for over 20 years. Together with Robert Erkstom, I've brought you Lymphatic Lifestyle Solutions online. It's a self-paced program in lifestyle modification techniques to help better manage your lymphedema and your weight. And as part of this program, we do promote a ketogenic diet. And so I wanted just to talk to you about some questions that come up when people are considering using a ketogenic diet. Of course, we always recommend that you do this in conjunction with and monitored by your healthcare provider to make sure that your own healthcare needs are being met. We don't know you, and we want to make sure that you are doing what's best for your own health. But if you do choose to do a ketogenic diet, one issue that can come up is constipation. Some people say that when they use a ketogenic diet, they get constipation. This certainly does not happen to everybody who uses this way of eating, but it can happen to some. And interestingly, constipation is something that can happen whenever you radically change your diet in any way. So you could be experimenting with very plant-based vegan diet, and maybe that's not something that you have been doing previously. So it's a radical change, and we can get constipated as a reaction to that. Of course, not everybody does, but that could be a response to any radical change to your diet. So, and also just to keep in mind too, what is constipation? Because just by not going to the bathroom as frequently as you're used to doing, that does not mean you're constipated. When you have true constipation, it is painful and it's very difficult to have a bowel movement. And so don't let the decrease in frequency lead you to believe that you are constipated. Of course, you will also, with constipation, you typically will feel some bloating and stuff like that. So if you are not feeling any bloatiness and it's not difficult or painful to have a bowel movement, then you might just be going less frequently because your food is much more nourishing with a ketogenic diet, and you're doing fine. It's quite often we do go to the bathroom less when we're on a ketogenic diet, so don't let that concern you. But if you do get true constipation, there's a couple things you can do. Dr. Eric Westman from the Keto Medicine Clinic actually recommends that his patients, if they have any issues with constipation, that they can use milk of magnesia. And so this has, of course, magnesium in it, and magnesium is very good for keeping you regular, keeping your stool softer. It also has other beneficial effects because magnesium is an electrolyte, and so it can help you with cramping. It can also help you with getting better sleep. So consider supplementing with magnesium, of course, with the approval of your healthcare provider. If these are issues for you, magnesium might help you with that. And so either a magnesium supplement or taking milk of magnesia. And so in short, constipation, not an issue for everyone who changes their diet, and especially for people who change to a ketogenic diet. But if it is, there are things you can do. I hope this has been helpful, and I'll talk to you again next time.